Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon, Dr. Alfred Bonati. Exciting show lined up. Let's get right to it. Joining us to discuss the symptoms and risk factors for DVT, deep vein thrombosis, is Dr. Angela Kokkosis, director of the Center for Vein Care, as well as director of the DVT team at Stony Brook Medicine. Thank you for joining us, Dr. Kokkosis.
Thank you so much for having me.
Certainly. So the first question is, what exactly is deep vein thrombosis?
So it's actually one of the more prevalent diseases we have in the country. It's a clot that can form in the deep veins of the leg, and about 200,000 Americans per year suffer from this deep vein thrombosis.
So what causes it? I mean, what are the symptoms and what are some of the, risk factors? When you talk about blood clots and things, I think of people who sit down all the time, people who are at a desk all the time, people who travel, there are these cross-country flights, things like that. Am I on the right path?
Yeah, absolutely. So periods of time where there is a lack of movement for really more than usual. Obviously, a lot of people have desk jobs. You sit at the computer for an hour or so. That's totally normal. But if you're for 6, 7, 8 hours immobile, not moving your legs, not flexing your calf muscles, then you are at a higher risk of developing a blood clot because you're not moving. And it is the calf muscle that helps keep the circulation going in the legs. You asked also about signs and symptoms. The most common signs and symptoms are pain at the site of the clot. You may see redness of the skin and swelling of the leg.
And how does it affect someone's, other than being painful? Does it prevent you from walking? Does it prevent you from climbing stairs? Anything of that nature?
Yeah, sometimes the pain can be debilitating, and it's also a sign that something is happening, and you should go and get it checked out. The problem with a DVT is that if it goes untreated, it can put somebody at risk for what's called a pulmonary embolism, where the clot breaks off and goes to the lung.
Is there any way to test for that?
Absolutely. Something as simple as an ultrasound can quickly diagnose whether there is a clot in a deep vein in the leg.
Why don't you tell us what you tell patients to kind of manage and prevent complications?
There are some other risk factors that are important to keep in mind. So, for the typical patient that is going on a long trip, that, it's going to be more than 4, 5, or 6 hours. I definitely coach my patients to make sure that they at least get up, move around, pump their calf muscles while they're sitting in their seat. Another thing is staying hydrated. Dehydration can also increase your risk for a DVT. And then there are some other underlying risk factors to take into consideration. For example, if a patient is ill, has some sort of virus or other illness, that can increase the risk. If a patient has cancer, that can increase the risk. If the patient has sustained some trauma or injury, that can increase the risk. Or even patients that are undergoing surgery, because there is a higher rate of inflammation in the body, that also can increase the risk of DVT.
And so would things like, I want to say massage, can you self-massage? I know every now and then when I've been sitting too long, I'll reach down and kind of rub my calf muscle a little bit, try to get some blood flow going again. Is that something people should be doing? And even professional massage, I just want an excuse to go get a professional massage. That's just me.
Yeah, in general, I think it's definitely good for your health. It's good for circulation. Incidentally, you're on the right track there, because when patients are essentially made to be immobilized, like in a hospital setting where you can't move around because of surgery and so forth, we actually put these squeezer devices called SCDs that squeeze the calf muscle like a massage to mimic the function of the calf when you're walking or, moving.
Would something like a compression stocking work as well?
Absolutely. Compression stockings are good because they do offer, a nice amount of pressure to the leg. So if you're going on a long trip or if you spend lots of hours sitting at a desk, compression stockings in general are good for leg health and for minimizing swelling. but it doesn't replace moving or getting that calf muscle to work as well.
When you see something like a varicose vein, is that anything to be worried about if suddenly it pops up more so than normal?
Yeah, it's a great question because incidentally, varicose veins are one of the most common vein problems in the country. Typically, varicose veins are benign, and they tend to be something that runs in the family. We tend to see a pattern that mom had them, dad had them, the sisters, brothers. So there's a little bit of a genetic predisposition, so it may not mean anything. And then a common question I get is, well, if I have varicose veins, am I at a higher risk for a DVT? Not necessarily. Patients do worry about that. I counsel them that as long as they're practicing good leg health, which is wearing compression stockings, staying hydrated, staying mobile, that's how they can reduce their risk for DVT.
What about, see, I remember years ago, my own mother, she had some really bad varicose veins and issues like that. And they actually they pulled the veins out of your leg. Now, this was probably 25, 30 years ago. Is that something that is still done, or are there better options out there?
Yeah, nowadays we do have better options. That stripping method is a little bit barbaric. We have more minimally invasive routes. Where without any incisions, we're able to remove varicose veins, perform injection sclerotherapy, which is a medication that also helps close the veins down. And we offer this for patients who typically have symptomatic varicose veins, where the veins are achy and they're hurting, or they may have issues where they bleed because of the varicose veins. So that's definitely an option.
What other type of work do you perform there at the Center for Vein Care up there at Stony Brook Medicine?
Yeah, so we offer all medical and surgical management for the veins. So when it comes to DVT, let's bring it back there for a second. Typically, the most common treatment paradigm is to put the patient on blood thinners, medication, and that's for most cases. In more severe cases, we may need to perform a surgery to remove the clot, a minimally invasive procedure. Through a catheter, we can actually suction the clot out. And it depends on how severe the clot is in the patient. And then that in conjunction with compression stocking therapy. We also offer stenting in the veins, in the deep veins when patients have chronic blockages. We treat pelvic congestion syndrome, which is another vein pathology. And then we also do treat arterial cases as well.
And obviously having a healthy cardiovascular system in general is a good way to go. Aside from exercise and diet and the obvious, is there any advice that you would have for our viewers of this program?
Yeah, no, I think you hit the nail on the head. We always talk about healthy lifestyle, healthy diet. It's good for your heart. It's also good for your circulation. So cholesterol management, blood pressure management, don't smoke cigarettes. All of these things can lead to bad outcomes when it comes to the veins and the arteries.
And if someone wants to learn more about DVT, where can they do so?
So we have a website it's vein.stonybrookmedicine.edu. And there's a lot of patient education information, as well as if patients are interested, we have free screenings for venous disease, vein disease, and arterial disease, and they can sign up online as well.
Well, thank you so much, Dr. Angela Kokkosis, for joining us on the program, talking about DVT awareness, and that is deep vein thrombosis. Thank you again for giving such important information to our viewers.
Thank you very much for having me join you today.
We'll have more after the break. You're watching American Medicine Today.
The loss of coordination in my legs, I'd trip over my feet, end up flat in the concrete. Dr. Bonati to me was God sent. Walk like that in a while. I don't remember how long. I didn't have to make a massive lifestyle change. I noticed today that I could sit and stand up without a cane. I would have to give it excellent and above my expectations.
Visit AskBonati.com. A great line from a popular Frank Sinatra song goes, "For it's hard you will find to be narrow of mind, if you are young at heart." Kim Manley from Spring Hill, Florida is a beautiful example of this advice from Old Blue Eyes.
I work from home. I run a staffing company, so I fly back and forth to Michigan and New Orleans. I do all the bookkeeping, the payroll, the billing. Hobbies, I love to get out and walk. I can't sit still, so I like to go places. I love to go shopping. I love to go to the mall. I coached cheerleading for many years, so I've always been active until my back. I just am a very active person. I don't want to be my age, I guess is what I would say. So I try to do a lot with my 22-year-old, and we do a lot together, keep up, go shopping, go out, go dancing, try to be young at heart.
But Kim had been quietly fighting back pain for many years. After her move to Florida, she began to look for help.
When I first started having pain years ago, I was living in Michigan. I worked for the steel mill for the Big Three. I was noticing that every morning when I got up, I couldn't get out of bed. I would ache until I got in the shower. That was the start of it, but I thought, I'm getting old, but it was getting worse and worse and worse. 3 years ago when we moved down here, we moved into the house and moved some furniture around. I thought I pulled something in my back. And it just started getting worse and worse to the point where I couldn't sleep. I would end up in a fetal position on my back, on my stomach, on the floor, stretching my legs, trying yoga, until I started going to doctors and saying, help me. The first doctor I went to was in Brooksville. Immediately, they did pressure point shots and wanted to do 5 shots and said these would help. They lasted 2 weeks. I felt good for 2 weeks, felt like I could do jumping jacks, and then it was worse than before. Then they sent me to physical therapy 4 times a week for 8 weeks. It was so bad the first time that I couldn't even walk again. So they had me coming back 4 times a week just to go in a tension rack and stretch me, put ice, send me home, go back the next day, do the same thing. Until the end, they said, there's nothing we can do.
Having only been made worse by physical therapy, she returned to her physician in hopes that there would finally be a solution.
Went back to the doctors and he said, well, let's try epidurals. You do not want surgery. Surgery is no guarantee it will ever fix you, and you could be worse off. So that is something you do not want. So I walked away from that, came home. My life was just getting worse and worse and worse to where my husband had to help me out of bed. I couldn't stand and do dishes. The pain in the bottom of my back just shot down my leg on fire. The pain that I had was so hard to decide where it was. It sat so low in the bottom of my back, and it came around down my legs, the side of my legs, all the way down to my ankles. I couldn't tell whether it was right side or left side because it was so bad, but it seemed like the right side was worse. I'd stand over the sink to try to do dishes, and in 2 minutes, I was back on a heating pad. I had no clue, what it was. I started thinking, the worst thing. Of course, you think the worst thing because it was just getting worse and worse. And when you can't walk anymore, the first thing you want to do is, I've had enough, let's go to emergency room. That's where we ended up.
She shares more of her experience in the hospital, a situation the Bonati Spine Institute hears about routinely from surgical guests.
The emergency room, of course, wanted to check my stomach. They did CAT scans on my stomach. They did, X-rays on everything they could. They did blood work. And at the end, and while I was sitting there on the gurney, I was like, can you please give me something for pain, please? And they were like, well, we'll go ask somebody. They give me muscle relaxers. And of course, it didn't even touch me. So after spending hours in there, then they said, well, we'd like to keep you overnight. We'd like to check your heart. And I said, no, there's nothing wrong with my heart. I want to go home. So I signed out against my will because I knew at that point they were just running every test on me possible. So we came home that weekend. We went to dinner Sunday, driving to Sam's on the beach, seeing Dr. Bonati sign. My husband said, I'm tired of hearing this, call him. So picked up the phone that Monday and talked to a girl immediately. Dr. Bonati calls me back himself. And within a 5-minute conversation, he said, yeah, I think I know what's going on. I think I can help you.
The muscle relaxers she was prescribed were never going to help, as Kim was suffering from a severely pinched nerve. To correct this compression, she had a multi-level procedure from her L3 to S1 vertebrae.
Dr. Bonati come in. He, brought all the stuff out, hung up all the x-rays. They draw on it, went into more detail what was going on with the stenosis and what had happened, and said, yeah, we can fix you. They were very thorough because I was very nervous, but they explained everything to a T. I knew exactly what they were going to be doing. And next thing you know, I was in surgery early that following Monday. When I went into the room to have the surgery, the lady said, lay down on your stomach, face down in the hole. She said, we're going to give you something to make you relax, but we'll be talking to you. The next thing I know, my husband was standing at my head, and they were, checking my nerves. Can you feel this? Kim, can you feel this? Can you feel this? Everything was good. I didn't have no pain. It was like, wow, I'm awake, and it's gone. I felt great. They wheeled me into recovery. I asked for coffee. They gave me a couple of cups of coffee, and I said, can I go home? They said, can you walk? We need you to get up and walk down the hallway back. And I said, yeah. I walked down the hallway, walked back. Can I go home? I came home, and I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Because of the tailored approach to treatment at the Bonati Spine Institute and patented tools used in surgery, there is significantly less post-op pain and, as a result, a fast return to work and everyday activities.
They told you to walk, a good half hour, 2 20-minute sessions, and that was Tuesday. We had already bought tickets to go to the Country 500 concert, which is a lot of walking, and we left Thursday and went to that concert. I bounced right out. The pain was gone, and I was back to being very active, doing what I normally do, walking, playing with the dog, shopping. Sleeping for me at that point was so much better because I was so tired from not sleeping. I would roll over in the middle of the night. I'd wake up through the night. My husband had to help me out of bed because I just couldn't get out of bed. I bought new mattresses, new pillows, propped me up, and I had the best sleep. After that, I started sleeping through the whole night. I do not wake up anymore in pain.
Now Kim's life has changed for the better.
I think that people get scared when they hear back surgery and they don't know what to think. And these other doctors, they just give you this pill or that pill, or like for me, I'd have 5 injection shots at once, and they just give you a runaround. Those shots don't fix you. There's something underneath that is underlying that needs to be fixed. He's got such a 98% high rate that this is going to be fixed. Okay. And he fixed it. And I tell people, don't be scared, go there. I've sent people there, and I will continue to send people to them because it's amazing, the before and the after, the pain that you go through, and then one little surgery on that table, you get up feeling like a new person that day. For me, it was just amazing.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Roku, Amazon's Fire TV, Google Play Store, and Apple's App Store. Welcome to American Medicine Today. A thrilling new work of fiction was just released, which takes a thought-provoking look into the near future and will make readers question the price of groundbreaking technology in the realm of fertility. Joining us to discuss is Kira Peikoff, author of Baby X. Thank you for joining us.
Thanks for having me today.
The premise behind your book has been called terrifying, and really it is. Can you explain the plot and how you really came up with that idea and how it is kind of based on reality?
Yeah, so I got the idea for this book while I was in graduate school at Columbia studying bioethics. And it revolves around a new medical breakthrough that is already in the works today in labs in Japan primarily. Already in real life, this has been proven to work in mice. So we're not in humans yet, which is what my book projects as a near future world. But essentially, this breakthrough allows the cells of any part of your body to be turned into sperm or egg cells to then be used to create embryos. So this would eradicate IVF. It would mean that anyone of any age, any gender, or any fertility status could have a baby with anyone else. And all they need to do is give a small sample of their cells, like from a cheek swab. So that is the premise at the heart of my new book.
How would that factor out as far as like paternity? right? Because if you can just take saliva or any cell and become pregnant by anyone at any time.
This idea that bioethicists have been worried about for years, ever since this technology first came on the scene, and the first paper was published around 2012, there's this idea of the celebrity scenario, which takes what you said to a whole new level. So you can imagine there would be a black market for the cells of highly desirable people like pop singers or athletes. Mm-hmm. What would happen if the cells from celebrities were suddenly subject to this pursuit in this black market? So that's the heart of the thriller aspect of the story.
Celebrities already have a problem with paparazzi stalking them around just to take photos. Can you imagine when and if this proposed scenario becomes a reality? I mean, again, back to the ethics and morality of it. You know, if paparazzi wants to stalk around and pluck a hair out of Britney Spears' head, you know, somebody could end up with basically saliva or any of that. I mean, you had to have done a ton of research into this. Did you speak with any experts? Like, how did you research for Baby X?
I did. So there's a top professor at Stanford whose name is Henry Greeley. He wrote a book a few years ago called The End of Sex, The Future of Human Reproduction. And it's all about the nonfiction aspects of this story. So what would happen legally, ethically, medically? How would society come to terms with this technology, and how should it, because it's coming down the pike anyway? So he's kind of the go-to person to really have a solid understanding of what's coming. And I did speak with him a number of times for the story. I asked him all kinds of weird questions, like, if somebody was creating a black market for these cells, how long could they get away with storing them, and how would they transport them, and what equipment would they use in a lab to, you know, manipulate them into embryos, and all kinds of things like that. So I acknowledge him in the book, and also for anyone who's interested in the real world ramifications of this, highly recommend his book as well.
Give us the plot of the book, and what sort of little nuggets of facts from this guy did you actually weave into the plot?
Yeah, so the plot centers around the main character is a biosecurity guard. She was a researcher who abandoned her academic career and invented this new business of protecting celebrities from would-be stalkers and anyone who might want to claim a part of their cells that they inadvertently left behind in public. So she goes around with this pop singer on tour to kind of clean up and make sure none of his hair or mucus or saliva or anything that's a living part of his tissue was left behind on anything. And they end up falling in love. So that's very early in the story. But I remember asking Professor Greeley, like, if she was going around cleaning up things after him, would it have to be a living cell? And how long does the cell stay alive? Or, you know, we lose skin cells all the time. Does that count? And it really comes down to be able to create a sperm and egg cell, it has to be living tissue, which does stay around for a couple of hours. So like if you sip on a water bottle, you have saliva there, it could have some living cells on it still for a while. And if you get it into the right kind of culture medium, which is a stabilizing liquid, you could transport that sample into a lab if it wasn't too far away, and then start deriving cell lines, which are just copies and copies of those cells to then manipulate chemically and turn into the sperm or the egg, which means a celebrity could become truly a mother or a father technically, because it's agnostic. The cells can become either with the technology. So that goes into the plot as well.
But you're saying they could be both mother and father at the same time?
Potentially, if like somebody took a sample of your cells, you could get either eggs or sperm from that. So the whole idea of like paternity and maternity is no longer beholden to today's limitation.
We're going to take a quick break and we'll be back with more. You're watching American Medicine Today.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
This type of surgery is so much more advanced, and the recovery time is so much less that it's just a no-brainer. If you've got pain, go to Bonati.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome to American Medicine Today. I wanted to go back to something you said previously when you were discussing the research with the other gentleman. And did he say sex is going to fall by the wayside? Or just the way we reproduce?
Well, everyone's still going to have sex, right? We're animal beings after all, and we have needs. So that will never go away. But to do it for reproduction, he projects that will eventually fall away, because what we're doing when we reproduce our way, the old-fashioned way, is we roll the genetic dice. Right. You know, we may have mutations we pass on to our kids that will haunt them down the road or cause fatal diseases. And why, if we have a way to get around that and have, let's say, dozens of embryos created from our cells with our partner, and then we could have the ability to screen those, which we already have today. Imagine that ability even more sophisticated in the future. Right. Why wouldn't parents have a demand to do that and make sure they're only implanting the embryo that's free of Alzheimer's and cancer risks and all kinds of things like that? Right. So eventually this would become the norm, and the old way of doing things would be seen as reckless or irresponsible even. And that's ethical part of this. And also I just want to add too, from the way things are today with screening embryos, if somebody's doing IVF, already today, this came out on the market in the last couple of months. It's possible to pay around $2,500 for a whole genome sequencing of the embryos created through IVF. So every gene can already today be sequenced and then provide information to the prospective parents on what these embryos may be predisposed to. So we're already there in a sense, and it's just going to get cheaper and more accessible in the future.
It's fascinating and scary all at the same time.
I guarantee they're already doing this in China. I'm just saying. That'd be the country where in these secret labs, you know, they're cloning all of their
Island of Dr. Moreau. I tell you all the time, it's really all the gene editing and animals and people, and
we're getting there.
We are. But thank you so much for being on to discuss. Dr. Kira Peikoff, author of Baby X. Thanks for being on the program.
Thank you so much.
Thank you for watching American Medicine Today. We'll be back next week. And if you would like to check out our show anytime, anywhere, download the American Medicine Today TV app. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.